Joint replacement recovery protocols are essential for ensuring patients regain optimal function and quality of life after surgery. Whether you have undergone a knee, hip, or other joint replacement, the recovery process is structured and multidisciplinary, involving surgeons, nurses, physiotherapists, occupational therapists, and the patient themselves. Recovery begins before the operation with preoperative education and continues through hospital care, rehabilitation, and long-term self-management. The journey to recovery starts with preoperative preparation. Patients are educated about what to expect during and after surgery. This includes information about pain management, wound care, the importance of early movement, and the role of physiotherapy. Rehabilitation or targeted exercises before surgery may be recommended to strengthen muscles, improve flexibility, and enhance cardiovascular fitness. This preparation can help patients recover faster and reduce the risk of complications. On the day of surgery, patients are admitted to the hospital and undergo the joint replacement procedure. Modern surgical techniques aim to minimize tissue damage and blood loss, which supports a faster recovery after surgery. Patients are closely monitored in the recovery room for vital signs, pain levels, and any immediate complications. Early pain control is a priority and may involve regional anesthesia, oral medications, or patient-controlled analgesia. The enhanced recovery after surgery, or ERAS protocols, have become a cornerstone of modern joint replacement recovery. These pathways are evidence-based and designed to reduce hospital stay, improve outcomes, and minimize complications. ERAS protocols include multimodal pain management, early nutrition, and most importantly, early mobilization. Early movement is encouraged as soon as possible, often within hours of surgery, to reduce the risk of blood clots, pneumonia, and muscle wasting. In the first few days after surgery, patients are assisted by physiotherapists to begin gentle exercises. These may include ankle pumps to promote circulation, quadriceps contractions, and gentle range of motion activities for knee replacements. Early flexion and extension exercises are vital to prevent stiffness and maintain joint mobility. Hip replacement patients are guided through safe movement patterns to avoid dislocation and promote healing. Walking aids such as walkers or crutches are used to support mobility while protecting the new joint. Wound care is another crucial aspect of early recovery. The surgical site must be kept clean and dry. Dressings are changed according to hospital protocol, and patients are monitored for signs of infection such as redness, swelling, or discharge. Swelling and bruising are common in the early stages and can be managed with elevation ice packs and compression stockings. Patients are advised to change position regularly to avoid stiffness and pressure injuries. Pain management is tailored to each patient and may include a combination of medications such as acetaminophen, non-steroidal anti-inflammatory drugs, and opioids as needed. The goal is to keep pain at a manageable level so patients can participate fully in rehabilitation activities. Effective pain control also reduces anxiety and supports better sleep, which is essential for healing. As patients progress through their hospital stay, the focus shifts to increasing independence in mobility and daily activities. Physiotherapists and occupational therapists work with patients to improve walking balance and strength. Functional activities such as getting in and out of bed, using the toilet, and climbing stairs are practiced under supervision. The use of walking aids is gradually reduced as strength and confidence improve. By the time of discharge, patients should have a clear understanding of their home exercise program, wound care instructions, medication schedule, and follow-up appointments. A safe home environment is essential for recovery. Patients may need to make modifications such as removing trip hazards, installing handrails, or using raised toilet seats to prevent falls and support mobility. The initial recovery phase at home typically lasts 6 to 12 weeks. During this time, patients continue their rehabilitation exercises, focusing on increasing range of motion, strength, and endurance. Walking is encouraged and the use of walking aids is reduced as tolerated swelling and discomfort may persist, but should gradually improve. Patients are advised to avoid high-impact activities and to rest as needed while balancing activity with periods of rest. Regular follow-up appointments with the surgeon and physiotherapist are scheduled to monitor progress, assess wound healing, and address any concerns. X-rays or other imaging may be used to check the position of the implant and ensure proper healing. Any signs of infection, persistent pain, or unusual symptoms should be reported immediately. Rehabilitation exercises form the foundation of joint replacement recovery. For knee replacements, exercises may include straight leg raises, heel slides, knee bends, and stationary cycling to improve mobility and strength. Hip replacement patients may focus on hip abduction exercises, gentle stretching, and walking. Swimming and cycling are often recommended as low-impact activities to maintain fitness without stressing. The new joint resistance exercises are gradually introduced to build muscle strength around the joint. By 3 months after surgery, most patients experience significant improvements in pain, mobility, and function. Many can walk without aids and return to light daily activities. Driving may be possible if the patient can safely control the vehicle and has sufficient strength and reaction time. Always consult with the surgeon before resuming driving. At 6 months, most patients see continued progress in strength, stability and flexibility. Daily activities become easier and many patients can participate in recreational activities such as golf, gardening or dancing. High-impact sports and activities that risk joint injury should generally be avoided unless specifically cleared by the medical team. Long-term recovery continues for up to a year or more after joint replacement. During this phase, patients may notice gradual improvements in strength, flexibility and endurance. Maintaining an active lifestyle is essential for joint health. Regular walking, cycling, swimming or other low-impact exercises help preserve joint function and overall health. Weight management is also important to reduce stress on the new joint and improve long-term outcomes. Throughout recovery, attention to potential complications is vital. Blood clots or deep vein thrombosis are a risk after joint replacement. Patients are often prescribed blood thinners and encouraged to move frequently to reduce this risk. Signs of a blood clot include swelling, redness, warmth or pain in the leg and should be reported immediately. Infection is another serious complication and may present as fever, chills, persistent wound drainage or severe pain. Early intervention is crucial to prevent joint failure or additional surgery. Joint stiffness or reduced range of motion can occur if rehabilitation is not followed closely. Regular stretching and strengthening exercises are necessary to maintain joint mobility. In rare cases, manipulation under anesthesia may be required to break up scar tissue and restore movement. Dislocation is a risk after hip replacement, especially in the early weeks. Patients are taught safe movement patterns such as avoiding crossing the legs, bending the hip beyond 90 degrees or twisting the leg inward or outward. Special pillows or supports may be used to maintain proper hip alignment during sleep. For knee replacements, achieving full extension and at least 90 degrees of flexion is an important milestone. By 6 weeks, most patients should be able to walk without aids and perform basic activities independently. Ongoing exercises focus on building muscle balance and stability. Nutrition plays a supportive role in recovery. A balanced diet rich in protein, vitamins and minerals promotes healing and supports muscle and bone health. Adequate hydration is also important, especially if patients are taking medications that can affect kidney function or fluid balance. Emotional and psychological support is an often overlooked but essential part of joint replacement recovery. Patients may experience anxiety, depression, or frustration during the recovery process. Support from family, friends, and healthcare providers can help patients stay motivated and engaged in their rehabilitation. Peer support groups or counseling services may also be beneficial. Enhanced recovery protocols emphasize a patient-centered approach to care. This means involving patients in decision-making, setting realistic goals, and providing clear education about the recovery process. Multidisciplinary teamwork ensures that all aspects of recovery are addressed, from pain management and wound care to physical therapy and psychosocial support. For some patients, particularly those with complex medical conditions or limited social support, inpatient rehabilitation may be recommended after hospital discharge. These programs provide intensive therapy and medical supervision to support recovery before transitioning home. Returning to work depends on the type of job and the individual's progress. Patients with sedentary jobs may return to work within a few weeks, while those with physically demanding roles may need a longer recovery period. A gradual return to work with modified duties may be recommended. Sexual activity can usually be resumed when the patient feels comfortable and has sufficient mobility and strength. Patients should discuss any concerns with their healthcare provider to ensure safety and comfort. Travel is generally safe once the patient is mobile and wound healing is complete. However, long journeys may increase the risk of blood clots, so it is important to take regular breaks, walk around, and stay hydrated during travel. Ongoing follow-up is important even after the initial recovery period. Regular checkups with the orthopedic surgeon help monitor implant function, detect any early signs of complications, and provide ongoing support for long-term joint health.